Can a shoulder injury, can shoulder pain cause a neck injury or neck condition, cervical spine condition? And how does that affect the argument that a neck injury could be secondary to a shoulder injury when it comes to disability claims? Military veterans with neck pain or neck injury should understand the potential association, and I'll discuss that in this video. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help military veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service, so you get the compensation that you deserve. I'm asked frequently to argue on behalf of a military veteran wanting to claim his or her neck pain or cervical spine injury, argue that it resulted from a previously service-connected shoulder injury. I've seen tons of denial letters over the years from the VA. You have to understand, this is part of the nature of being an orthopedic surgeon, especially triple board certified orthopedic surgeon. The vast majority of the veterans that come to me having already been denied for a condition. And I don't know that I've ever seen cervical spine injuries approved, given service connection, secondary to a shoulder injury, short of like when they come to me, then they get approved sometimes, but they're almost always denied. So many times, probably 30, 40, 50 times I've seen that denial where the VA denies service connection for a neck injury, cervical spine injury as secondary to a shoulder injury. It's not to say that there isn't evidence that it could be. There was a systematic review of 76 scientific studies. Researchers showed there was clear evidence that cervical spine pathology can cause shoulder pain and that shoulder pathology can cause neck pain. They observed shoulder and spine pathology often overlap. Again, it's not cause and effect, and that's where that's tricky, but one is associated with the other. There was another study looking at the impact of shoulder dysfunction on basically associated neck disability in patients with shoulder problems. What they did, the researchers analyzed patients specifically with subacromial impingement, rotator cuff tendonitis, so to speak, and frozen shoulder. The prevalence of neck pain was 60% in patients with subacromial impingement, and it was 62% in frozen shoulder. So what they believed is that the activity or overactivity of the trapezius led to neck issues, again, primarily based by that shoulder problems. Overactivity of that upper trapezius was thought to be related to compensating for the shoulder function. It elevates the scapula, led to alterations in range of motion through shoulder shrugging, also prevented narrowing of the subacromial space. So basically, it was compensatory to try to decrease pain in the shoulder, leading to neck pain, especially in those muscles around the neck. They concluded that shoulder dysfunction, again, range of motion restrictions such as frozen shoulder or weakened rotator cuff muscles in the case of rotator cuff impingement, can lead to neck issues. The trick to that is, yes, maybe it could cause pain. What would be hard to argue is, could that actually lead to degenerative disc disease in the cervical spine or facet osteoarthritis or neuroforaminal stenosis, spinal stenosis? That would be a much harder case to make. You could use these studies. I suspect very often the examiner would say there's no proof of cause and effect. And to be fair, they're right. And I think this is one that most orthopedic surgeons and spine surgeons would be a little reluctant to say, yes, definitely a shoulder injury, rotator cuff tear, dislocation, things can cause degenerative cervical spine conditions, can cause neck pain. Whether that leads to degenerative conditions, that's a lot harder. I strongly prefer arguing cervical spine, especially degenerative cervical spine conditions, primarily caused by wear and tear from military duties, heavy lifting, lots of overhead activities, lots of things like that, rather than as a secondary condition. It can be done. It's just, I don't know that I feel as confident about it as I do for so many secondary lower extremity conditions. Hip caused by the knee caused by the foot or ankle, back caused by the hip or back caused by the knee, I think are much more straightforward and much easier to show studies to support that. Also, if you have left shoulder, usually you can very successfully argue right shoulder caused by the left. Cervical spine can be done. It's just a lot harder. Now, if you want, I wrote a recent ebook recently. I'd love for you to have it. I'd love for you to look at it, learn more about the disability claims process. You can get that free, that ebook, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and what you can do to beat them. Just click the link in the description below this video. It's completely free. Now, if you're interested in a Nexus letter for your injury or condition, I would love to help. There's a link in the description below that video, and you can click that link at the ebook as well. And that'll give you all sorts of information about working with me and my team. You can certainly reach out that way and we can talk to you. I work very hard. My team works very hard to make the process simple, to make it as quick as we can for you. And I really try hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you.